Welcome to Deuk Spine. I'm Dr. Deuk Majan. Shot. I am going to be performing the Deuk plasma rhizotomy on our patient here who has back pain from the L1 to the S1 region. And our target, Jordan will show you, shot, is the medial branch of the dorsal ramus at L1, L2, L3 shot, L4, L5, and S1 shot. All right, so you can see the transverse process I'm aiming for. It's right there, I'm on it, shot. And this is the L2 transverse process. You have to make sure you're right on top of the TP, which I am. TP stands for transverse process. The pain nerve that is responsible for transmitting all the arthritis pain runs just on top of that transverse process shot, right where the tip of this thing is. See the tip? Show them, Jordan.
Yes, we do.
That is literally exactly where the nerve is. He's not liking this. Dr. Berndes, that's fine. We're almost done. We just need a few more nerves to get. These nerves we're destroying are not the kind of nerves that go down your leg. They're the kind of nerves that only carry pain signals from the facet joint. Yeah, we're almost done. Shot. All right. But moving around is not good for me or the patient. Shot. All right, you see how the tip of my probe is like sitting on that bone right there? That's the perfect position for the rhizotomy. That is exactly where the pain nerve runs. You agree, Jordan?
Yes, sir.
Yeah. And so I think I got it. And I'm going to go now to the next one. As a matter of fact, I'm going to make a separate incision because his curvature is so bad. Shot? That's it there? All right. Go ahead. Come on.
We have a couple questions.
I will take those questions.
First one coming from Lanu on YouTube.
Shot. Hi, Lanu. Welcome.
Asking, after the surgery, do you recommend any additional treatment for this patient?
Shot. Well, we may not get to the sacrum today, so we are going to have to bring him back and do his sacroiliac joints. So yes, I'm going to recommend additional treatment for him because we were supposed to do the sacroiliac joints, but he's been under anesthesia for going on 2 hours now, and it's just, at his age, it's not really a safe thing to do. So we're going to bring him back and do his SI joint. So that's the only additional treatment. Besides that, it's just walking. That's the only thing he needs to do. Get his muscles rebuilt, get his nerves firing and recovering from being pinched for so long. Great question. Shot?
Next question is coming from Pawn Lust on YouTube.
Hello there, Han Lust. Welcome.
Asking, is facet hypertrophy what rhizotomy can also treat for pain? Although
Yes.
I assume that this is only if there isn't much squeezing on the nerve.
Shot? There is no squeezing of facet nerves, first of all. The squeezing you're talking about is the kind of nerves that go down your leg. We're not treating those nerves, we're treating his facet nerves. So the nerves going down the leg were treated earlier with his Deuk laser disc repair, where we went in and treated the painful disc but also unpinched the nerves. That was the prior surgery we did. That was streamed earlier, just before this one. So Facet hypertrophy comes from arthritis of the facet joint. Shot? Arthritis is what causes the pain these people experience. They're getting pain from the arthritis. 5, 4, 3. I'm going to make the incision a little bit higher. All right, we're going in with the probe. Is that a new one? Thank you. And we're going to treat the facet higher up. Shot. Jordan, I need you to move up, please. 5, 4, 3, 2, 1. Come on, Jordan. All right. Very good. There it is. Jordan, why don't you point for the audience where the L1 transverse process is? Shot. I'm heading up there right now to do this procedure. Yeah, again, because of his curvature, everything is out of normal place, okay? Shot. I need about 5 minutes, Dr. B. How's he doing from an anesthesia standpoint? Good. All right. Now I've got to dock my probe right on top of that transverse process. Shot. So I've got to use the x-ray machine to find it, but also I have to use my hand to feel where is this thing, right? Shot. Yeah. That could be it. I'm on top of bone. Shot. But no, that is not it. There we go. I think that's it right there. Shot. All right, much better. I'm on the bottom margin of that transverse process.
We have another question
Yes, shot.
coming from Joseph on YouTube.
Hi, Joseph. Yes.
Asking, can
Shot.
symptoms of numbness, tingling, and pins and needles in the feet by caused from cervical issues, not just the lumbar spine
Shot.
issues?
Yeah, it's rare to have those symptoms of tingling in the feet from cervical spine issues. I would say it's unlikely the cervical spine, but it certainly could happen. Sean? It's far more likely it's neuropathy, which is nerve damage in the feet, or from the lumbar spine. Sean? The most common cause of tingling in the feet would be neuropathy, which is nerve damage. Fine nerve damage has nothing to do with pinched nerves in your back or neck. It will never get better with surgery. Sean? That's one thing I look for in my patients to see, do they have neuropathy? That's why we order nerve test often, because I can't fix neuropathy with surgery. We want to make sure people understand that. We don't want them believing they're going to get better. Their neuropathy symptoms are going to get better when we can't make them better. Surgery can only fix certain things, not neuropathy. Just about done. Any more questions?
No current questions, so we do have a comment coming
Shot.
from William on YouTube saying,
Thanks.
I'm here, I need T-lift fusion.
Yeah. Well, William, that's wonderful. I would love to do your surgery, but I have to agree you need a T-lift. And I'm not so sure I would. But if you want to know, just do our free MRI review. It's free. I mean, honestly, what more could you ask for? Free, right? So that's what I would recommend, William. Get the free MRI review. All right, let's do another incision. I had to make 2 incisions on each side for his facets because he has so many of them we're treating. I did L1, 2, 2, 3, 3, 4. Sorry, L1, L2, L3 with 1 incision, and I'm doing the other with the other incision. I am going to try to go back and do 4 again. And remember, his spine is extremely twisted, so it makes the surgery so much harder for me, technically, but also for the patient. That's perfect right there. I'm on the bone. I can feel it. I feel really good about that. 2 more to go, and we'll be done. Shot. I am going to bring him back to do his SI joints if he wants, because I just don't think it's safe. We're at past the 2-hour limit, right? And I don't want him having any issues. We like to do everything under 2 hours if we're doing this type of propofol sedation. He is laying on his belly, Sean, and when people lay on their belly, they can, have trouble breathing. Try laying on your belly for 2 hours and breathing. It's very hard to do. So people get tired, and I don't blame them. So I think we've got just about everything done except for the SI shot. Any other questions?
We do have a question coming from Lana once more on YouTube. This was the same question they asked before. I think they just missed it. They said, they asked, after the surgery, do you recommend any additional treatment for this patient?
No additional treatment. Just we need to finish his SI joints, which we didn't get to. Shot? That's all.
Other than that, no current questions.
So he's still going to have pain from his SI joints. Shot. And not much I can do about that today. But we'll be ready for him when he's ready to come back. Shot. I did the upper part of the SI joint. Shot. But I didn't do the lower part. So, shot. 30 seconds. I should be done with the upper part. I don't know, Jordan. There's bone there. Shot. That's what we want to feel, is that bone right there. That's where the nerves pass. The pain nerves that go to the SI joint. Shot. 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 All right. Yep, I can actually feel the pain nerve right there. That's great. Shot. I'm going to try to get a few more of these pain nerves to the SI joint. So, great, we're done. Hope you enjoyed surgery. We did a lot. This is a lot more than we would normally do on a patient, but he wanted to get it all done in one shot if we could, and I thought we could try. We couldn't get it all done. Unfortunately, we got 90%, but there's still the SI joint, bottom half of the SI joint. So we'll bring him back and do that. He lives a couple hours away, I think, so an hour away. That's not bad. I don't want to push the limits here. We've got to want to keep him breathing. Oh, you can see some of the herniations from the laser surgery here. All right, thanks for joining us. We'll be back with another surgery soon.